Hey caregivers, thank you for visiting the Caring Corner. In this video, I want to talk about the difference between Alzheimer's and dementia and how understanding this might affect care for your loved one. My answer to the second part of this question might surprise you. Now here's the quick answer. Dementia is a symptom, or maybe a series of symptoms, and Alzheimer's is a disease that causes dementia. It's just like having a fever. Fever is a symptom that's due to some underlying medical cause. It could be an ear infection, a kidney infection, rheumatoid arthritis, malaria, almost anything. And in the case of dementia, the symptom is brain damage, accompanied by a decline in capabilities, things like memory loss, sleep disruption, forgetfulness, agitation, difficulty in completing tasks. It's named for a German physician, Dr. Alzheimer, who in the early 1900s studied patients who had dementia symptoms, and in autopsies of their brains discovered the plaques and tangles that have become the hallmark of this disease. Now, it's understandable that there's confusion between Alzheimer's and dementia, because Alzheimer's is the leading cause of dementia. And according to the Alzheimer's Association, it's responsible for as many as 80% of all cases. But there are many, many types of dementia. If you look on the internet, you'll see many different numbers, but it's safe to say that it's well over 100 different kinds. Some of the big ones include vascular dementia, which commonly occurs if your loved one has had a stroke, fronto-temporal dementia, and Lewy body dementia. Now, does the type of dementia you have matter, and how does this affect care? I recognize we live in a modern world and everyone wants to know as much as possible about the disease affecting their loved one. And we feel that if we know what the disease is, maybe we can solve it. So certainly from the perspective of your loved one's physician, knowing the specific disease is important and helpful. However, from the point of view of in-home care, which is non-medical, it rarely makes a difference. And that's because the best way to care for an individual is not based on his or her diagnosis, but it should be based on his or her particular symptoms. How are they acting? What are their behaviors? What are their triggers? It's common, for example, for someone with Lewy body disease to have hallucinations. But there are other forms of dementia that could also produce hallucinations. And someone diagnosed with Lewy bodies may not have hallucinations. It's a common saying in the dementia community that if you've seen one case of dementia, you've seen one case of dementia. Again, the best care focuses on the person and not the disease. And if you're trying to set up care for your loved one, please see this following video regarding important questions that can drive a successful care plan with caregivers. Once again, thank you for visiting the Caring Corner. I got into caregiving a long time ago when my mom was diagnosed with Alzheimer's. Caregiving can be a roller coaster, and if you find this content helpful, please like and subscribe so others may find it as well. Thank you.